It is just awesome to be here in this tent with all of you. Just like Peggy said, the vision of the Aspen Institute is a free, just, and equitable society, and we can track that back 70 years ago to the Big Bang right here in Aspen, Colorado, when the founders of this institution put people together to think about how to create the world that they wanted. And that's what their legacy for us, our challenge, is to do that. Health is essential to that vision. For how can we be truly free if we are burdened by the fear of our loved ones suffering from diseases that are preventable or curable? How can our world be truly just if access to high-quality health care or the most promising new therapies is determined by place, race, class, or gender or sexual identity? And how can we build a society that is truly equitable when cultural and legal norms limit women's lives, including their ability to make their own health care choices? All of us here want that kind of society when we reflect upon the futures of our precious children and loved ones. This convening is about considering everyone as our children and our loved ones. Everyone in the country, everyone on the planet. A culture of health is a culture of freedom. The Aspen Institute believes that convenings like this one are essential to moving towards that vision of a free, just, and equitable society. Why do I say that? Because there's extraordinary power in building and gathering networks of values-driven leaders determined to make demonstrable differences in every way we can. By writing legislation that expands access to needed care, by finding and training the next generation of culturally competent healthcare providers at the local level, by working through the ethics of even the most revolutionary new technologies for altering life to make sure those technologies are used for good and not for ill, by applying the lens of health to all of our business practices, by addressing the social determinants of health, like nutrition, housing, education, income, and for that matter, racism and patriarchy. Let's be clear, it's values-driven leaders who make those differences. I'm thinking of people here today, so many, like the Ugandan human rights leader, Prima Kogala, who founded an initiative to help women and girls get access to free legal services. I'm thinking of Lisa Fitzpatrick, founder and CEO of Grapevine, which helps Medicaid-managed organizations help their patients improve their health literacy and thus improve the quality of their lives and their independence. I'm thinking of... This is a little bit like an auction or something because nobody knows who I'm going to call next. I'm thinking about the siblings, Hannah and Charlie Lucas, teenage entrepreneurs and mental health advocates who co-created the app Not Okay that helps teens deal with depression. I'm thinking about Senator Bill Cassidy of Louisiana, who before entering public office spent 3 decades caring for the and underinsured, including co-founding a clinic in his home state that provides free dental and health care. And I'm thinking of someone I can't wait to meet, Leanne Wen, the former city health commissioner and current president of Planned Parenthood, a brilliant, relentless leader in making sure women have access to the health care resources they need. Thank you all of our speakers, all of our attendees for being here. It's critical that we gather up leaders to identify emerging needs, include new voices, showcase promising practices, and break down the barriers to progress. That is what the Aspen Institute is all about. That's what the Aspen Ideas Health is all about. Activating change, making an impact, serving humanity, and getting results. Thank you all for being a part of this bold vision to create the world that we seek.